Good afternoon to everyone. Good afternoon. Thank you for being here. We'll get started in about 3 to 4 minutes, right at the top of the hour. We're looking forward to talking with you and speaking with you about the Grants to Schools program. So thank you and welcome. All right, well, good afternoon again to everyone. Thank you all for being on time. We're going to go ahead and get started. It is 1 o'clock and we want to respect everyone's time. I see we have about 100 folks in here, so we're glad to be here with you. My name is Damon Hoyle, and I am the Senior Operations Project Manager here at Texas Education Agency, and a bulk of my responsibilities are working on and handling our COVID testing program. I'll be joined today by my colleague, Matt Lashley, who is the Chief of Staff for our Grant Compliance and Administrations Department. And so he is the subject matter expert on grants. And so we're both here to navigate and to go through this webinar with you, and then to be able to answer questions at the end. So we'll move on to our next slide. So wanted to start this webinar, as we do with pretty much all of our webinars. We're just setting some norms and giving you all some reminders. So the first thing is, please use the Q&A feature at the bottom of your screen to ask questions throughout the presentation. And we have a Q&A segment at the end of the presentation. And so what we'll do is we'll go through as many questions as we can. Anything that we're not able to answer, we will respond either via email, or we will update our FAQ as we see questions that are themed, or we start seeing the same questions come up. I will say this in terms of questions, because this is a newer grant, we may not have all the specific answers to every question, but our promise is to get you an answer, get back to you as soon as possible. So kind of wanted to name that up front because every school district has its own nuances. And so some things we may not be able to answer today accurately. This session is intended to cover the 2021-2022 K through 12 COVID-19 grants to schools program. And the reason I mentioned that is because I know there might be questions on public health guidance or questions about other facets of COVID, but we really want to hone in and focus on the grants to schools program. We'll touch a little bit on the entire $800 million program because there's some things that overlap, but really want to focus us in on the topic at hand today. This session is being recorded. Just like the first webinar is recorded, we will post one of the webinars, if not today, by tomorrow close of business, so that anyone that didn't make it, or if you ever want to go back and review the webinar, you can. The content is the same for both webinars. We record both because we want to put the best product out there for you all. And then lastly, those public and private school districts, if you are listed in this spreadsheet, and that's the Houston spreadsheet, are temporarily being supported by TEA through November 15th. And that's with the $800 million piece in terms of access to vendors, but are considered a part of the Houston Health District CDC grant. As such, these districts are not eligible for the Grants to School program at this time. So let me just clean up all that jargon. There's a spreadsheet here, and I'm going to click on it so that you can see it. It's also on our website, but I'm just going to pull it up here and drag it over so you all can see it. So here is the spreadsheet. Any school district that is listed here, we're supporting in terms of access to vendors and supporting with tests through November 15th. But this particular portion of this, the grants to schools piece, this $221 million, you all would not be, these schools on here would not be eligible for access to the $221 million, but you do have access to those 4 to 5 vendors that we're offering tests through. So I just wanted to kind of make that distinction and say that up front. All right, so I will move forward. So this is just a disclaimer. This presentation is intended solely to provide general information and guidance to Texas LEAs and also private schools now, and reflects the Texas Education Agency's current understanding of the presentation topics and applicable federal guidance. The content of this presentation is subject to change as a result of further potential information and guidance provided by federal agencies with regulatory oversight of these programs. This presentation does not constitute legal advice, and districts or LEAs are therefore advised to seek legal counsel regarding the information and guidance provided in this presentation before acting on such information and guidance. So I wanted to put out our disclaimer as always. Agenda, pretty full agenda today. We went over our session norms already, so we can check that off. We're going to look at accessing session materials, grants to schools, the background of the grant, eligibility and requirements / considerations to participate in to be able to pull the $221 million and to be able to use the funds. We'll look at the funding and allocations piece specifically, look at the allowable activities that the funds can be used for, talk about the grant application process, and then talk about reporting and compliance, and then just show you guys some additional resources. And then at the end, we'll do the Q&A and get through as many questions as we can. So that is the agenda for the webinar. So I mentioned accessing session materials. Everything, or the majority of a lot of things that we're going to reference today can be found on our K through 12 COVID-19 testing project website. And so when you go to it, these are all the materials that you will see. We are constantly updating this website. And so I'm going to click here to go to it. It'll pull it up. Here is that page. And we're going to reference some different things that can be found here. And as you can see, next to each of them, a majority next to each of them, we have a date. That's the date that it was last updated. So we try to communicate to you when the most accurate information and when it's most current. And so as you go, you'll be seeing updates. We updated something as of yesterday. So we're constantly, as I mentioned, updating this website. So that is where you can access it. So I encourage you to toggle back and forth as we discuss different material. So background on the grant. So to kind of ground us again, a lot of this, some of this will be repetitive or information that you've already heard. So the U.S. Department of Health and Human Services, or HHS, will invest $10 billion from the American Rescue Plan to states to enable schools to establish COVID-19 screening testing programs to support and maintain in-person learning. So billions of dollars to schools in all the states so that we can get kids safely back into schools where research shows that they learn best most of the time, which is in the classroom. So that's what this money is for, and to help with those COVID mitigation practices. Texas, out of the 10 billion, we received approximately $800 million, about 803 million. And those dollars are flowing through the state health department to administer. So that money went straight to them, and then we're working with them to then funnel that money to school through either vendors or this specific Grants to Schools program. So within the $800 million, we're carving out 221 million of the 800 million for this grant program. And so this grant funding will be allocated to eligible public and private school systems. They'll be eligible for it and available for them to apply for, to use for several allowable expenses. Some of these expenses, and we'll go into the details later, include additional services and products in testing, like PPE and so forth, ventilation systems or HEPA filters, and we'll get into that, and then vaccination access. And there's a bunch of other allowable activities, but that's what this 221 million can be used for. The Department of State Health Services, DSHS, and TEA have partnered together to make these resources available to public and private schools. And so we've been working hard over the past months to get this grant and these different programs in front of you. So moving forward, the goal, looking at two different specific goals here. So when we think about the goal of the overall $800 million grant, it's to provide you all, the school systems, with needed resources to implement COVID testing programs and to support you for related prevention strategies for K through 12 public and private schools. And if you have a pre-K attached to your school, we're talking about pre-K as well. Now, this 221 million, just to reiterate it again, for those eligible K through 12 schools, this is an additional set of funds to further support your COVID mitigation prevention resources and activities, because we know, although the vendors, they are offering a lot, the 5 of them, there still might be other needs that are not met through them. And so that's why we're offering this funding amount, so that you all can access it and then get those other resources that you need to support your campuses and your schools. So eligibility requirements and considerations. So who is eligible? I'm going to pause here, allow you all to review the chart or the table, and then I'll highlight some things. Okay, so the same eligibility for public and private schools exists in this first column here. If you are a public or private school, K through 12 in Texas, and you're interested in accessing these funds for your school for COVID mitigation practices, you pretty much can. That's who's eligible for it. If you have a pre-K and or a daycare that is attached to the school, where the kids and the staff of that daycare or that pre-K co-mingle with the K through 12 students and staff, then you are eligible to apply for these funds. So if you're K through 12 in Texas, private or public, you're eligible to apply for these funds. Pre-K specifically, if they're attached, or daycare is attached to your school or to your campus, those school systems or those schools are eligible to apply for those funds. Ineligible was that list of schools that we mentioned that the city of Houston, who received its own set of funds, they'll be covering them. You would not be eligible to access this $221 million. We're supporting you through vendors, but not with the actual direct $221 million to your schools. Now, if you're a private or public school that is pre-K standalone, meaning it's an early childhood center or a pre-K center, or you're a standalone daycare, you would not be eligible to access these $221 million. And that's just a guideline and something set aside from the federal funders that It has, because you have to be attached to a K through 12 school system. Now, special note for private schools, special note. If a private school system applies and accepts these funds, they may become recipients of federal assistance, which means that that may make them subject to specific federal requirements. And so we know we wanted to say that up front, because we know that private schools have a little bit of different things that they have to adhere to being privately funded. And so we wanted to put that special note there for you all. With that said, I'm going to move on from eligibility, and I'm going to turn it now over to my colleague, Matt Lashley, who is going to go through and cover funding and allocation. So Matt, over to you.
Great, thank you, Damon. Are you able to hear me clearly?
Yes, sir, we can hear you.
Perfect. Okay, I'm ready for the next slide. So we will review funding and allocations. Looking at our number of participants, I want to first point out that this grant will have an eligibility and allocation list, which is what we're planning. So for public school districts that have applied to TEA grants, maybe numerous ones in the past, we envision an allocation list similar in format to what you may see with ESSER or other grant programs or other federally funded programs. So essentially, we are currently working at TEA to run formulas, models, and consider allocations for schools. So this is what we would, in general terms, refer to as a statewide allocation grant. So every eligible public school district would be listed on an eligibility list with a predetermined dollar amount for this grant. So again, internally working on that allocation shouldn't be confused with the testing allocations that you may have heard about. That's a different program. This would be a grant allocation that would be essentially give you the award amount for an eligible school to apply for. Again, that is posted when the grant is live. We're anticipating mid-October, so there's no grant allocation for each school to review right now. We are still working on that, but this grant would post on our TEA grant opportunities page, similar to where other grants are posted. The caveat here is this grant also allows us to fund private schools, as Damon mentioned. So we TEA does not oversee, regulate, or typically grant fund a private school. So we are still reviewing and determining allocations for private schools. So that will be, that could be a separate allocation list for private schools, or could be one allocation list for all public and private schools that are eligible. It's important to note, as Damon mentioned, this is a federally funded health and human services grant. So there will be, you will notice differences in the grant and the requirements, and as we get to it later, even in the reporting of how we operate this grant, because it is not from the U.S. Department of Education. So at this stage, we don't anticipate allocations being based off any federal other federal programs like Title I or others. We're considering enrollment-based allocations right now, but that's something that would be finalized when we actually post the grant. So the eligibility and the allocations don't become live or publicly available until the grant posts. Again, we're working to have that available mid-October. I am going to take a quick pause to drop in the answer. I know we were going to answer questions at the end, but I'm going to go ahead and post that link for the grant opportunities page. So if you're looking at Q&A, there should be answered questions and the link is in there. But the easiest way to find the grant opportunities page is if you go to the TEA homepage and you navigate to the very top blue banner. There is a link under popular applications that says grant opportunities, and that's our TEA grant opportunities page. So that's where all of our grants post and where we would have this grant information post as well. Next slide is allowable activities. At this stage, because the grant isn't live, we're going to review the allowable activities as we know them from the federal funder and our partners at DSHS. So these are general activities that may include a lot of potential budget or expenditures for the grant. So we'll be somewhat limited today in specific questions we can answer, but want to highlight a few allowable activities here in this first slide. Some of the allowable activities from an overview perspective include ability to use the grant funds for PPE, hygiene and cleaning supplies, portable and other small items that allow for HEPA, fan or air filtration, public health events, and vaccine promotion. So this is not an exhaustive list, but this is the overview of allowable activities. So keeping with the program purpose and goals, as Damon mentioned at the start, these are activities you will see there whose intent is to help with the safe reopening and continued operation of schools. Next few slides are actually directly from the federal guidance that Damon's providing here. So when we make these slides available, there's a URL at the bottom. You can look at the direct federal guidance that is being highlighted there from CDC. So this is a much longer list, but in the grant development stage we're at now, we are determining more specifics on allowable activities and also fielding your questions. So today, when you have questions about allowable activities, we won't be able to go too far beyond this, but we'll add those to the FAQ. So please post those questions in the Q&A. We'll be building the FAQ for this program so that we have it as robust and complete as we can for mid-October when the grant posts. Generally, this is a supplemental grant, so we anticipate pre-award and activities that come after May 1st. I'm going to talk a little bit about that in the next few slides with the grant application, but want to differentiate that this grant, unlike other COVID-focused or school reopening grants, is not going to cover activities back to the date of the pandemic or disaster declaration. And we'll get to that a little bit later. But when you go to the grant opportunities page, if you're exploring it, you will notice we have grants posted in several ways. But for this grant program, right now we are envisioning two application processes that are distinct. For our K-12 public schools, our plan as of now is to launch an application through our eGrant system, which is an online grant system for public schools. So this would be similar to the ESSER grants that school districts have applied for, likely to have different questions, some additional or other requirements, because again, it's not a USDE grant, but we are doing our best to try to launch this through eGrants for our public school systems to aid in efficiency of the grant application processing and collection of information we need for the granting of the funds. For private schools, this is a new territory for us. We've not directly granted to private schools in the past. So right now we're still determining the exact format of the grant, but in working with our partners in grants and budget and other teams, there's a possibility of launching a grant application that is PDF, email attached, a separate online form, or via eGrants. I can say right now that bulleted list is in order of what we feel most confident would be the application format. So right now, depending on how many private schools choose to apply for this grant when it launches, we would anticipate a PDF application, which would be submitted by email at this stage. But that always has a possibility to change as we're just under a month from when we anticipate launching the grant. So 2 grant systems for application, depending on whether or not you're a public or a private school, which we're still determining. And again, though, whether it's eGrants or a PDF application, we post all of our grant listings on that grant opportunities page. So between now and launch of the grant, you can go to that page if you're not familiar with TEA grants and see the layout of that system and become a little more comfortable and familiar with it in the meantime.
Hey, Matt, do you think, should we go ahead and click on it and let them see it, or do you want to move to the next slide?
You want to show the opportunities page?
Yeah, do you think it's worth showing, or you want to just go to the next slide here?
Yeah, we can, because we have probably have a mixed audience of private schools, and if you've got it pulled up, who may not have seen it before, but again, this is what the page looks like. So it's, for lack of a better term, it's essentially a grant catalog. So we've made some modifications over last year, but the application name would be one way to find the grant. So it posts by the application title, which we would publicize once it's live, but there's also a keyword search feature and some other filters. But basically at this view, the newest grants typically post at the top. But if you go to any one of those grants under view, Damon, even that first ECHS, the little magnifying glass, this is what a grant listing would look like. So we anticipate when this grant is live, it would be a version similar to this. If it's a PDF application, there would be a link where you see those hyperlinks that would provide an actual application form and all the information you need. That's also where an eligibility and allocation list would likely post. If it's an eGrants application for school districts, your LEAs, you're familiar with this, it would have this general information, but you would actually apply through a different system, the eGrant system. But this is what the grant opportunities page would look like if you want to explore it while we're still developing the grant application. And again, you can get to it right from the TEA homepage at the very top blue banner where it says grant opportunities. So you can get there within one click of the homepage.
Got it. Thank you. And I'm going to show them the homepage real quick, and then we'll move on to the next slide. So if we go here and they go to financing and grants, Matt.
Very top, even before that, under popular applications, right there. Yep, one click.
Look at there.
Yep. It's a little small, a little bit harder to see, but that's the fastest way to get to it. So that's where the information, if not the PDF application, would post when we get there.
Thank you, Matt, for that. I'm sure that's been pretty helpful for folks.
Yep. Thank you. Mentioned this for pre-award, but we anticipate pre-award back to May 1st, 2021, which would align with the actual federal funds being provided to the state. So what this would mean, this is the concept of pre-award basically means regardless of when the grant posts live, you would potentially be able to apply for activities that happen prior to your grant application. So we anticipate for this, the pre-award would be available back to as early as May 1st, 2021, meaning when you apply for the grant, any allowable activities under this grant that occurred May 1st to the date you actually apply would potentially be covered by the grant. So launches in mid-October, the pre-award would not negate allowable activities back to May 1st. Again, this is a supplemental grant though, so you'll notice that date is current year 2021. So this is not a grant that allows for supplanting of past COVID related or school reopening activities prior to May 1st. So this generally needs to show some supplemental or additional services that are allowable per the grant. There's always reporting and compliance monitoring with federal awards. So this is kind of very basic information, but we do anticipate specific reporting requirements for this grant. This kind of goes in a little bit into what Damon mentioned, that for private schools that apply for and receive this grant, this would make you a recipient of federal funds. Besides all of the federal requirements to receive and operate a grant recipients would anticipate some additional reporting requirements. Again, this is not U.S. Department of Ed grant, so we will essentially pass down any required reporting to our grantees as well to meet the requirements of the CDC Health and Human Services grant. So generally, this would be a part of what's incorporated in the grant application. Would include things like performance measures and other language about what a grantee would be required to provide. But essentially, these are outlined by our federal funders and our partners at state level at DSHS, but it could include reporting on a plan that details the strategies and other fiscal reporting. So these are all likely requirements we anticipate that would carry with the grant to any recipients.
And then I can jump in here, Matt, and then obviously, come in too if you wanted to add anything. But thank you for that piece as well on the reporting and so forth. So working with outside vendors, we've gotten quite a few questions about this. And so kind of to ground some folks who may or may not know. So the $800 million grant that we have, part of that money is set aside for DSHS, the State Health Department, who we're working with for vendors. And so these vendors are going to come in, and this is just a vendor screenshot of the vendor sheet that we've offered. And so these vendors are coming in to offer antigen or PCR/molecular test. And that can either be just to offer the test or to come in and do a turnkey operations where they come in and actually do it. And so when they do that, they're then going to bill dishes, the state health department, and then that'll be deducted from all of the allocations that we have set aside that we've posted on our website. So every district, public and private, that's applied in the past or that's going to be applying, we've allocated you amount of funds. As you use, if you choose to go with the vendors, as you get their services, we'll be deducting what they bill dishes from your allocated amount. The question for some folks is, hey, we're a school system that's already been using a vendor that's not listed here. Can we still use that vendor? Or if we want to seek a vendor that's not on here, could we do that? And so, as some of you probably already read on the screen, I'll read it for you as well. We are in conversations with the federal grant funders to determine if school systems can use these grant dollars to work with vendors they have previously and or are currently working with outside of those listed on the vendor resource sheet. This option, if you do choose it, and if it becomes available and you choose it, will require additional reporting, more details to come. And the reason it's going to require additional reporting is just because we have to make sure that as these funds are used, that we're able to report it to dishes, and then they can report it to the federal funders as well. And so with anything, they'll just be reports so that we can make sure we track where the funds and where the money is going. What I'll do is click right here on this, because we have made an update for those who are curious. We have made an update to this form. And so here it is. We've updated it with some information from some feedback that we've gotten from various school districts. And so if you go on our website right now, you'll see that the latest version was posted yesterday at 4:30. We've added some information there about some different things amongst the CLIA and some other things. So it is there for you just as another resource for those who want to go look at that regarding vendors as you make your decisions on what you need to do best for your school communities. So webinars, speaking of vendors, we have offered and are offering vendor webinars. So as you're making decisions about the vendors and about your comprehensive response to COVID through TEA and dishes, here are the different vendor webinars. We had one yesterday from 1 to 2. We have one with Thermo Fisher today from 3 to 3:45. Quest Diagnostics will be tomorrow from 10 to 11. There's 3 tomorrow. Affinity Empowering 11 to 12, and then SDI Labs 1 to 2. If you were to click here, you can register, but if you go on our website, which I spoke about earlier, you can go there to register. All of these are being recorded and will be posted. So if you missed them or you want to go back and hear detail, we're going to be posting every vendor webinar along with an FAQ, along with the slide deck or the PowerPoint or any materials that they provided to the public. So we're going to post all of that on our website so it's there for you and easily accessible. One other note, we had Affinity one of the groups presented yesterday. We're going to have them represent again on Friday. So if you want to join us Affinity, we're going to have them represent. So I actually can update this later, but we'll have them present again later this week. And so we'll update our website of those who want to rejoin that webinar. So just wanted to point that out. So I'm going to move forward. Speaking about resources. So we've, as I said, tried to put a lot on our website, but if you have questions around the grant, best practices, public health guidance, interplay with the grants, test coordinator information, or just the 221 million, how can we use it, what's allowable, you would email TEA at covidcasereport@tea.texas.gov. I will say that some folks have requested a phone call or two, and we have started to take some of those if it's in a dire need, set up a quick phone call to just work through some things that can't be done via email. Now, if you have questions on the vendors, their responsiveness, delivery, or their reporting requirements, you would then email dishes at tcec@dishes.texas.gov. So these would be the different ways in which you would reach us regarding your questions. We had a webinar yesterday and we have a webinar today. We're going to post, as I said already, a webinar recording. This one is being recorded right now. We will have it posted by tomorrow, close of business. And the slide deck will also, that we've presented here, will also be will be posted. If you missed yesterday's, it's fine. It's the same material, same exact information, maybe a tweak or two of something. Other resources, I've already kind of talked about this several times. Please visit our website. our COVID website, we've offered and we have a lot of information posted there. If you go here, it says COVID support public health orders. You simply click on K through 12 COVID-19. It takes you there and it has a list of everything. All the webinars you can register for. Once they're posted, it'll all be there. So please definitely check out that website. It'll be your best friend during this testing project this year. Offer some other websites here. So these are third-party websites and third-party resources. So this ELC grant from the federal government has added some guidance at their website called the Open and Safe Schools website. And so it's great. It gives you a lot of information for schools about COVID, about the bringing in-person learning back. And so it's a great resource to go to and to reference as you're looking to support your schools. And then they have there's another website that we wanted to take you guys' attention to. It's called When to Test Calculator. And so what this website does is the When to Test Calculator illustrates how different mitigation strategies can minimize the spread. So it lets you know when you should be testing. You can fill out some information, start it, and it'll kind of guide you through when's the best time to test and so forth. So it's another great resource. And I'm not going to click on this one because it's the CDC. We all pretty familiar with them, but they have a testing toolkit that we definitely say check out as you continue to support and continue to respond to COVID throughout your school district or school system. So with that said, before we jump into the Q&A, our last required notice is right here. This K through 12 COVID-19 testing project is supported by the CDC of the U.S. Department of Health and Human Services as part of a financial assistance award totaling $800 million with 100% funded by the CDC and HHS. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by the CDC, HHS, or the U.S. government. For more information, please visit the Center for Disease Control website. So once throwing that last required notice there, and now we're going to jump into some of our Q&A. So I know Matt has been answering, and Matt, if you wanted to jump in here and if you would like to point us to certain questions that you've already answered, if not, I'll kind of work through.
Yeah, I think if we go to the top, I think we've answered a few, and I think Brooks is answering some as well. I think we have testing questions, mostly have answered most of the grant questions we can. So I can kind of go from the top and just mark them as answered live if you want to address them verbally, Damon, if that works.
Got it. So I'll take this first one. We can get just the test kits from these vendors, correct? Yes. So the test kits will come from those vendors. Yes, ma'am. And if you still, let me throw this out there too, because this is also a question. If you were previously, if you were in the previous programs, meaning that you received tests through our stopgap program in August or from last year, and you still have tests, meaning the Abbott Buy Next Now test, you can still use those tests. Those tests are still good if they're not expired, and you would still report those results the same way you did through the Texas Rapid app. So if you still have tests, you can still use those. We want to make sure that you're using your resources so you can use both at the same time. These vendors have been very slow to respond. Is there any help from TEA staff that can help? Got it. So a couple of things. Thank you for your question. I want to answer because it's a very transparent and forthright question. So thank you. So the vendors we know have been, because we've been meeting with them, have been hit kind of hard the last week, but they've assured us that they are getting caught up. If you have specific questions on delivery or you need to know when the vendor is going to respond, then I put it on here and I'll go back to that slide. Please contact Dishes, which is this bottom email address here, because they are the ones working directly with the vendors, although we work with them as well, but Dishes is the one mainly working with them. Is COVID-19 testing project application open already, or will it be open? It is already open. So not the 221 million grants to schools, but just if you are looking to get access to these vendors and you are a public school that has not already opted in the past, then you would need to apply. But if you had opted in back in January from last school year, or you just opted in this August for the stopgap program, then you're good. We should have already posted, and you can look at the allocation spreadsheet on our website. Your name, school name should be there with your allocated amount. If it's not, let us know. If you're new though, if you've never opted in as a public school, then you need to go ahead and fill out that application. It's open and won't be closed anytime soon. Private schools, regardless if you opted in the past or not, you need to apply for the new testing program. Some have already done it, but if you've not opted into this new testing program for this school year, any private school needs to do that. And that's because we don't have as much access to your information as we do public schools. And we want to make sure that we have the most up-to-date information to get you what you need. There is no Affinity Empowering tomorrow at 11. Yes, that webinar, and that's why I said I got updated. There's no Affinity tomorrow. It'll be on Friday. So if you go to our actual website, that information is actually more accurate. So thank you for catching that. That's an oversight on our end, but no problem. If you go to our website now, and I'm gonna, let me go back, you'll see that it should be updated. If it's not, we can take care of it. But if you go there, I'm clicking in now, just to further answer this question, go to K through 12. We haven't posted it yet because we just confirmed. We're going to be updating this. Affinity we're going to do another one with them on Friday. So we'll get this updated, but the other ones are correct. So thank you for catching that. All right. So it's a difference from testing webinar we attended September 9th. This is different from the testing webinar. So this one will be posted. This was specifically on the $221 million, which is grants straight to you, to schools to use for those allowable activities. The one on the 9th and the one on the 10th talked about the vendors and what that program looks like. This was focused on additional funding that you could use on those allowable activities. Could we potentially use these funds to pay for a school nurse? So, and this is a good question, and Matt, I'm gonna let you jump in here too. Let me throw this out there. There is a completely other grant, another grant, that's a $39 million nursing grant that we received that we have through the State Health Department that we have allocated to all 20 of the education service centers. And they are using that money to then ensure that nurses get to the most in need campuses throughout their region. And so that's a separate grant. If you want more information, you can email us at COVID Case. I've already been responding to those emails. So Matt, I do want to touch on this though. When we talk about salary and stipends and using these funds, Matt, did you want to reiterate anything there or clarify?
I just wanted to add, we showed 4 slides of allowable activities. That very first list with the 4 or 5 bullets, the way this works is at the federal level, the Health and Human Services grant for states across the country. There's a longer list of allowables, that list of 21 or so that Damon's showing, but prior to that, we had a little list about 5 or 6. These are based off what we have determined so far to be allowable in this grant based off the state's application. So the way this works is our partners at Health and Human Services here in Texas applied for this grant with a proposal of what the grant would be used to do. So at this stage, these are what we envision as the allowables. The future slides that Damon shows are what the federal allowable lists of expenditures. So that's why we say the grant application is still in development. And any questions about allowability, we really can't speak beyond this. So to Damon's point, we have a separate nursing grant. So it's likely the allowable activities of this state grant wouldn't provide a need we already have covered in the nursing grant. So it may look like almost anything is allowable. What we want to keep in mind is we're operating a statewide grant that's going to focus on certain allowable activities based off what Texas was approved for. So those are the types of details we iron out between now and mid-October. So when a grant application posts on that page, our FAQ and your grant application and guidelines is as clear as we can make it so that you can determine if you'll be applying for this grant or not based off what's allowable. So in these items, if you notice, some of these seem very straightforward: PPE, hygiene, cleaning supplies, HEPA, but you get to public events and promotion, there is a possibility that you would need staff or personnel to do these things. So what we're being told now, and what we're still finalizing is we believe some payroll could be allowable in this grant by the time we finalize, but we're being told it won't allow for outright stipends. And this wouldn't, based off what we've shared today, wouldn't necessarily allow you to reimburse vaccine promotion done prior to May 1, or to pay for public health events for staff that are doing things during their regular workday. When a grant's supplemental, a good example of that 4th bullet is if you applied for this grant and we're going to host a public health event to promote vaccinations, you wouldn't be able to pay staff who are already, for lack of a better phrase, on the clock or in a normal workday, with grant funds because they're already paid to do what they're doing. So the activities have to be supplemental. You get to something like PPE, you could be potentially using the grant to purchase more PPE or cleaning supplies. So that's where payroll becomes a little trickier for us, but we're working with our state DSHS partners to get all the guidance we can between now and when the grant launches to build our FAQ and the grant guidelines. So you're very aware of what's allowable and what's not when you determine if you're going to apply for the grant.
Thank you so much, Matt. Great grant subject matter expert here. So thank you, sir. These next 3 questions I'm going to answer at once. They're all about testing and funding and so forth. So here's what I'm going to do. I'm going to advance these slides and I'm going to go to our website and I'm going to show you all something. Just because I want to be able to show you where it is. So I'm going to our website and I'm going to go under, this is under the public health orders card. I'm going to go to K through 12 testing project and I'm going to go down to, I'm just going to stick with, let me go with our allocation list for K through 12. We have private school allocations and then we have our K through 12 current opt-in list. So I'm going to click here and make this a little bit bigger. So while you're viewing that, also listen to this as I'm answering this question. So someone says, I'm confused about participation in this program. Are we automatically enrolled in the program if we have been testing already? If you had already been testing using the TDM test, either from last school year or in August through the stopgap program, you were automatically moved into this program. We wanted to eliminate barriers and didn't want you to have to apply again. So because of that, we went through and your name is populated here and it'll tell you you've opted in previously. Yes, we put your name there, your district ID, your region, and then we went ahead and populated it with your allocation. If you are not already in the program, but you're a public school, we say no. And so then anyone that has a no here would need to apply. If you have a yes there, you do not need to apply because you were already in the program. So if you go to this allocation page, look for your name and see if it says yes or no, because that's what we have on record. If for some reason you have a no there and you should be a yes, email us and we'll update that. And if you do not see your name at all, there were a couple of shorter schools or so that we needed to confirm. Email us, we'll confirm that you're a school that exists and we'll update this with your numbers. We've also highlighted it as Houston schools because we're going to be funding those schools through the vendors through the 15th of November. And then after that, Houston will support them. Now, someone also asked, if we need more tests, where can we get them from and are they funded? You have been given an allocated amount from this grant. You would reach out to those vendors. If you already have a yes next to your name, you can begin to reach out to those vendors. And then you can use our vendor resource sheet to do that. So let me go back here and let me go to our vendor resource sheet, which is here, which is updated yesterday. You would go here, you would read through what they offer. SDI, Achieve, Therma, Quest, Affinity. You would go to the bottom, contact them. And as you request tests, we will then, from your allocated amount of funds, we will then subtract from your allocated amount of funds monthly. And so that's how that works. You've been allocated an amount, you reach out to the vendors, that money is then subtracted, and then these allocation sheets are going to be posted multiple times a week so that you can see where you are. So that's how that works. So these tests through the vendors are of no cost to you in terms of you have to come out of pocket, but it would come from your allocated amount of the funding. Someone says that they were on a call with their local dishes person. They said that you could still order from TDM. TDM's role in supporting schools or providing tests to schools, rather, let me say it that way, ended September 15th. If you still have their tests, you can use them. You can also report them. But in terms of them taking new orders to supply new tests to schools, that concluded September 15th. And this new vendor program that I've just gone through is the new program that you would use to get future tests on top of what you already may have gotten from TDM. So I hope that clears that up. How soon can you start placing orders? If you're on this allocation sheet and there's a yes next to your name, you can call them today. You can reach out today. I submitted a request to PPT. If you submitted something to TDM through STAR or something like that, and you need to follow up, I would follow up with TDM directly because we didn't get to that. And so that would be something that they're best equipped to answer. So if you email TDM for something and you haven't gotten a response, you can email them back and they'll give you a response. What was the email address to inquire about additional nursing? So if you need to inquire about the nursing grant, you can email us at, and I'm putting it on the screen, let me go back. You can email us at covidcasereport@ta.texas, this email address right there. Yes, the vendor piece and the e-grants piece are two different things. The vendor piece is the allocated spreadsheet that you can use. This 221 million is separate. It's within the 800 million, but it's a separate amount of funding that we're making available to schools so that you can access it to get additional things for your COVID response that are on those allowable expenses. So it's two different things. The vendor thing is specifically test, rapid test, PCR testing. This 221 million allows you funds that you can apply for these other allowable expenses that the vendors are not necessarily covering. So we wanted to make sure that you got a comprehensive access to resources. The vendors provide tests. This $221 million offers you funding for these allowable expenses that also help or go along with your COVID response. The amount that is reflected on the spreadsheet is what you're now working with. If you got tests from TDM, those tests do not account against your allocation. So what you see in that allocated amount is what you're working with from now moving forward through the vendors. Whatever test you got from TDM is not going to be deducted from your allocation amount. Someone wanted to see the vendor resource sheet again. I can share with you. It's also on our website. So I'll walk you through it that way so that you can access it. This is the vendor resource sheet, and it's also on our website. So I'll leave that up while I'm going through these next questions. So as soon as you apply, if you've not applied, our allocation sheet is going to be updated pretty much daily. And so when you go on there and you look at your name, you look for your name to be on the allocation sheet, and then next to it, it should say a yes. So that's when you'll know it's confirmed, because you will appear on our allocation spreadsheet with an amount of funding allocated to your school system, private or public. And we do have, just to answer that question, because I'm sure it'll come up. And I'm navigating this just so you can see how you would navigate it yourself. If you go here, because I know it might come up for private schools, we have a K through 12 public schools list, and then we have a private school list that we recently posted. And as more private schools apply, we will update this list daily. So we have a private schools list and we have a public schools list. If you were a public school system that you opted in before, for the 221 million, yes. Regardless of who you are, if you want access to the 221 million and you're eligible as a public and private school system, you have to apply to e-grants. The vendor situation is different. The vendor situation, for access to those, you automatically roll over and you can check this allocation spreadsheet. But if you want access to 221 million, everyone who's interested would have to apply when it's posted mid-October. Two separate things. You don't roll over to that program. You have to apply for the 221 million. Someone asked me about the lead time to get tests from vendors. It just depends on the vendor when you would receive those tests. I couldn't speak specifically to each one. They said that as soon as your order is in, they're trying to respond within a few days. But the detailed in terms of how many days and depending on what you order, that would be a question that you would have to direct towards the vendors, or you can look at our vendor resource sheet to see if it's there. Our test research report. So yes, so reporting requirements. And a lot of these questions are also in our FAQ. If you were with the TDM program, you reported through the Texas Rapid app. You continue that if you still have those tests. For any new tests that you get through a vendor, each of them will require their own reporting mechanism or reporting requirements through their portal. So you would, once you decide to go with a vendor, they would lay out for you, because they have an onboarding process of what they require you to do and where to report what it is that they have. Somebody said, so to clarify, I applied to the testing side of the grant. When should I expect to be approved so that we can order tests? So if you applied and you're not already on the list will be updated again tomorrow by close of business. So you'd be able to look tomorrow late afternoon, and there'll be a new updated list with anyone that's applied in the last couple of days. And moving forth, we're going to be updating that multiple times a week. You'll be able to go on and see. Pretty much we're going for daily, but you'll be able to see if your allocation amount, if it's changed, and then if you were added to the list if you weren't on there before. You still do report the TDM results, yes. We had having issues with the medical disposal. What is the ending date for using the testing allocation? The amount of money that you've been allocated is for the entire school year. So once you use it up, then your allocated funds would then be depleted. Now, in January, we're going to review all of the allocations. And if we see that some schools are more heavily using the test than others, we're going to reallocate some funds, because we want to make sure those who need them get them. And any reallocation of funds, folks would be notified. But once you use up what you have in terms of the allocations on the spreadsheet that I have up, then that would be your amount of funds for vendors. But you could still have access to the $221 million for other needs in terms of COVID response. So someone says, when you mention test, are you referring to the rapid testing or the 3-day testing? It just depends. So when I'm talking about the TDM stopgap program or that we worked with TDM on, that's the rapid test. When I'm talking about the new test, it just depends, because each vendor has their own tests that are available, and some of them are rapid, some of them are PCR. So when you ask me the question, it just depends, because a lot of the vendors are offering antigen and PCR. So if I'm talking about the vendors, I'm talking about both antigen and PCR. If I'm talking about TDM, then I'm talking about just the antigen test. You have to change. If you have to change an administrator, when would you be identified of acceptance to new administrator? So if you've emailed us a COVID case, we have some more emails we're working through, but all of them should be responded. Any emails that we were backlogged by tomorrow morning. And as you want to update a test coordinator or someone like that, we update our master list. So, and then we just reply and say, hey, our list or our information has been updated per your request. So we got about 6 minutes left. Matt, was there anything else you wanted to add? Anything you wanted to, just in case?
No, I don't think so. I'm looking through the questions, and I think you've answered most of them. You may want to take another look. I think you've covered most of them were related to testing, but I think we've covered about 9 left there. I'm not sure if they were addressed fully or not, and they're in the testing realm. So you may want to look at those, but I think we've covered most.
Yeah. What you saw on the allocation sheet has nothing to do with the stopgap program. What you saw on the, those are two different things. This new program is not related to the stopgap program. What you saw on the allocation sheet is what we allocated to you based on a whole new formula. In terms of what you've used from the previous program, that's not what we have posted. So 2 separate things, not the same program. When do we get confirmation? So when you apply, we're updating it daily. You would know because you would go to our website, look at that allocation sheet, and then you would see your name appear, and it would say you would have an allocation amount, and you would have your name would be there. Are the reporting requirements? Yes, every vendor has its own reporting requirements. As you go through the different webinars, if you can attend them live or review them or call them or look at their email or look at their website, you can find out more information about what they require in terms of reporting. It's funny. But yes, for clarity, we will not be allowed to use funding for pre-K centers that are apart from districts but standalone. That is correct. If it is a standalone daycare or pre-K, you're not eligible for this funding, nor the $800 million vendor piece either. You have, so great question. Someone asked about, will the vendors take the use test? That's a great question. We'll add that. That's a question that we can ask vendors. I don't want to give you the wrong information. As you attend the webinars, if you do, you can ask them that live, but then we can get further information for you on that particular question. So if we select a vendor to buy tests, what do we need to provide the vendor if we decide to go with them? So the vendors have the same access to the allocation sheet that we do. And so as you call them, they're checking the allocation sheet to ensure that you appear on that list before they actually provide you tests, because they want to make sure that they get paid. And so if they don't see your name there with an allocated amount, then that means you haven't been approved yet. So all you simply do is call them, give them your official school name, they'll verify you, and then you'll go from there. I think so moving forward, new test kit ordered, the new vendor will be deducted. Yes. Someone said, so moving forward, the new test ordered through the new vendors will be deducted from your allocation. Yes, it would be deducted from your allocation. So someone asked, and this is a question that's come up several times, about nurses and about the standing delegation order, and if nurses are covered to be able to administer antigen PCR tests. We're currently in conversations with the State Health Department and the CDC so that we can produce and give you guys the exact language around the standing delegation order to ensure that nurses are comfortable and covered to administer these tests. And so we're literally meeting about that over the past few days, and we should be able to release some information to you all very soon about that, because we do know that that is a question that's come up quite a few times. Last three, we got 2 minutes. I'm gonna try to clear these three out. To clarify, I applied to testing side of the grant. When should I expect to be approved? We're updating that daily. So if your name is not there by tomorrow, you should see your name there because we're updating it. It'll be updated by tomorrow, close of business. We're having issues. I talked about the medical piece. We'll get back to you on that one, but if it's specific to a vendor, then that's a good question to ask them. So you're, and Matt, someone asked, do we record as revenue and expense? So Matt, did you want to take that one for the $221 million one?
So we will take that one to FAQ with our federal fiscal monitors answer the question about recording the value of the tests on general ledger. So
Okay.
Good question, Mary. We'll answer that because our accounting questions will likely grow on that FAQ. So we'll flag that one as well. Good question.
Got it.
Same as the fund number question, Mary. There'd be a fund number for a grant program when that launches, but as far as a fund number with the testing, that's something we will address in the FAQ as well as we build out the accounting guidance. Same for Rose as revenue and expense. So we will plan some accounting and coding recording questions in there for the testing and the grant piece.
Got it. Well, thank you
yes,
all.
Grant is not available. Again, we will post it and share with this group through Damon when it posts. We're planning mid-October.
Yep, perfect. Well, we're right at 2 o'clock. We want to honor everyone's time. Thank you all so much for joining us. This webinar will be posted by tomorrow, close of business, for you to rewind and watch. And we look forward to continue to supporting you all with your COVID needs throughout the rest of the school year. So thank you. Have a great rest of your day, and we will be in touch soon.